you selling these books? Okay, what is your name and what brings you here?
I'm Francie Epperson and I'm here because I have Lyme.
Okay, and how long have you had Lyme?
I've found out that I've had it for 14 years, but I was just diagnosed 1 year ago.
Okay. And what were your symptoms?
Actually, I didn't have hardly any symptoms, or at least I didn't think I did. I actually did have atrial fibrillation, sleep disturbances, some things like that. A difficulty breathing when I was exercising, you know, like gasping for air. I had a number of things, but my husband had all the real severe joint things, and we thought he had Lyme, and I kept following him around from doctor to doctor trying to find out what he had. And it ended up that I had it too, and I'd actually had it for longer.
What's your name?
Hi, I'm Rebecca Waldron-Taranis.
Okay.
And I'm from York, Maine. I ended up at this conference today a few years back. I have a 5-year-old, so he was maybe 2 and a half at the time, and he was presenting all sorts of symptoms. In the car, all of a sudden, he didn't want loud music, a real sensitivity to light. He was complaining of aches and pains, saying his tummy just felt icky, that his head hurt. He'd wake up in the middle of the night, tell me, "Mommy, my finger hurts," and he'd just want to lay in my arms, where normally he'd be outside playing and running around. And so we started bringing him to the doctors and documenting all his odd behaviors, and we couldn't figure out what was going on. Our pediatrician thought that it might be Lyme. She ran the Western blot test, and it came back negative. He had some positive bands, and so at our doctor's office they wouldn't treat him. And we didn't know a whole lot about Lyme. So I came to this conference a few years ago just searching for answers and thinking that potentially might be what's going on with my son. And one of the doctors got up and he put a slideshow up of what does Lyme look like in pediatrics. And I just burst out in tears because there was my child. The light sensitivity, the sound sensitivity, the icky tummy feeling, everything. And so I became educated on Lyme and had a second test done and sent to IGeneX laboratory, a more sensitive lab, and his tests came back skyrocketing positive. We got in to see a Lyme literate doctor, and after months of treatment, my son is symptom-free now for, I don't know, about, what is it, a year and a half, 2 years. Healthy little boy, and I'm really grateful for, if I hadn't come to this conference and gotten some information, he'd probably still be suffering now. So, pretty exciting.
That's good. It's nice to hear that good news. Thank you.
It is.
Thank you for sharing.
Thank you.
Hello and welcome. I'm Heather McLean, and today we're going to be talking about Lyme disease, a very controversial subject but important in learning what you can do to protect yourself from Lyme disease, and if you have Lyme disease, perhaps find some different kinds of options if you're not finding them in the current medical care that you receive now or don't receive. Joining me today is my husband, Jeffery Greenfield. He's an osteopathic doctor from Manchester, New Hampshire, who just spoke at a Lyme 411 conference in Laconia on April 20th. He was one of the presenters there, along with, we had Bob Jaguar, and he is a person who's going to be talking about testing for Lyme disease. We also had Scott Manty, who's a PhD. We also had Jordy Thompson, an MD, and my husband. And then there were other people and vendors there talking and showing people how to prevent Lyme disease and showing different books and Lyme disease awareness. So can you let us know what you spoke about in this conference today, Jeff?
Yeah, so I was asked to speak on adjunctive treatments for Lyme disease. Okay. And it included osteopathic treatment, nutrition, herbal issues, and a few other things.
Okay. All right, great. So you can kind of see that the people who came to this conference either had Lyme, have Lyme, or have children with Lyme, or loved ones with Lyme disease. And found that they wanted to get as much information as they could to be well informed. So I did not get to film this actual conference on the inside, but I was able to interview people who were there and my husband, and so that's what we're going to go with today. All right, so first of all, we're going to be discussing the controversy with Lyme disease society. So one is IDSA and one is ILADS, and they each have a different thought on what Lyme disease is. And Jeff's going to give us some information on that controversy and why that's important.
Okay. So first, there's two schools of thought on how to manage Lyme disease. The majority organization are the infectious disease doctors. Now you have to understand that infectious disease doctors are kind of the king of infections. They set the guidelines for things like tuberculosis, for things like AIDS.
Okay.
They study this, they work with it, and they set guidelines for Lyme disease. And in their guidelines of Lyme disease, the Infectious Disease Society of America has, in their viewpoint and in their review, come up with the idea that Lyme disease is an acute illness that can be treated fairly easily with a few weeks of antibiotics, and even prevented by one dose of antibiotic after a tick bite, and that things such as chronic Lyme disease do not exist.
But they say that you can have post-Lyme syndrome.
Right. And
Okay, so, but that's not Lyme disease.
yes. And in my reading, their idea of post-Lyme syndrome is a syndrome where there are symptoms but no infection, and no infection that would respond to antibiotics. Thereby they say long-term antibiotics are not indicated in any Lyme or Lyme-related
Okay.
issues for the most part, and I think they have some exceptions to that.
Okay.
Now, the International Lyme and Associated Disease Society, or ILADS, is a group of physicians, other healthcare practitioners, naturopathic doctors, who treat most of the people with Lyme disease and long-term Lyme disease. And I'm a member of that, and so the information that you'll get from me will be slanted in that direction.
Okay.
But we believe that Lyme disease does exist in a long-term infectious form. And we believe that Lyme disease is a difficult disease to treat. And we also think that very often you don't just have Lyme disease, you have Lyme disease and one of its friends or co-infection partners,
Okay.
such as Babesia, Bartonella, Ehrlichiosis, and others, that make this disease complex much more difficult to treat.
Okay, so what's the technical name for the Lyme disease? Burgdorferi.
Yeah, so the Lyme disease causative organism is a bacterial organism that looks like a corkscrew.
Okay.
It's called a spirochete, and it has similar aspects as does syphilis. Syphilis is also a spirochete.
Oh, okay, okay.
So, however, it has much more genetic information in it, and
Okay.
it seems to be much more prevalent, and it's not necessarily sexually transmitted as its main mode of
As
transmission.
its main mode.
And again, that's controversial.
That's another, okay.
That's another subject. And so the Lyme disease spirochete is called Borrelia burgdorferi.
Okay.
Okay. And
Okay, so excellent. So that's the controversy. We're trying to kind of compact this because there is so much information. We can't cover it in all of this time slot that we have.
And if I can interrupt just for a second,
Okay.
and in the controversy, I have to say that most doctors out in the public follow the infectious disease guidelines because they're
Right.
kind of, they're supposed to tell us what's right to do.
Okay.
But I think in this instance, they may be missing the boat in a lot of our
Yes.
patients.
And a lot of it seems to have to do with testing for chronic Lyme, and we'll get into some of that later. What I'd like to do now is to show a clip of the current legislation in New Hampshire that was brought about by House Representative Gary Daniels, who helped to pass a law that enables doctors like my husband to utilize antibiotics more long-term than is considered appropriate by the Infectious Disease Association. So we're going to show you that clip with Gary Daniels, and then we'll come back and talk about symptoms and other things about Lyme.
And just before we go to the clip, just to set the stage,
Right.
a couple of years ago, or early on in my treatment of Lyme disease,
Okay.
there was the risk of being called before the medical board because I'm not following the majority guidelines.
Right.
And it has happened in other states, not in New Hampshire, and it's currently happening still in other states. But because of Gary Daniels and the Lyme community that actually promoted him, promoted this legislation and brought it to Mr. Daniels, we now have protection so that I can actually be on TV and do this clip, whereas before I may have kept my head very low.
Welcome, Gary, and I just wanted you to talk about how that legislation came about.
Okay, thank you, Heather. It came about because I had a friend who I graduated high school with who came down with Lyme disease. It took her 8 years to be diagnosed. And she had gone from doctor to doctor. At one point, she went to her primary care doctor and said, I want to be tested for Lyme disease. And he told her to go find another doctor. Well, she ended up going to New York City to find her doctor. And I became aware of others in the state that were having to go out of state, whether it was Rhode Island or Maine, New York, places that they would go because the doctors were protected from prosecution or having their license pulled when they used long-term antibiotics for treatment of Lyme disease. So the bill that I put in, and it took us 2 years to get it passed because the first year we ran up against a lot of mindset, well, we want to study it for the year. And though it came out, and this was in 2011, 2010 I guess maybe, that we came out with the bill, and it came out of Health and Human Services 18-1 to study it. Well, we fought that on the floor, turned that into a 300 to 56 ought to pass vote. It went over to the Senate, and they voted 13-11 to study it, which effectively killed it in a committee of conference. So we brought back exactly the same bill next year, and we had a different makeup in the legislature, and the bill passed on voice vote.
Oh, wow.
All the way through. So what the bill said was simply that no doctor can be prosecuted by the Board of Medicine simply because they used long-term antibiotics for the treatment of chronic Lyme disease. That does not take away any kind of malpractice or anything like that. So we fought hard with the Medical Society and the Board of Medicine on that, but we were successful in getting a link put on the website for the Board of Medicine now where someone can go in and see that statute there. And as I've heard, it seemed like more and more people now are being able to be treated in New Hampshire rather than having to go out of state. So that was our primary purpose, and I have to give all the credit to those in the Lyme community because when we had the public hearing, we had over 200 people show up. And there's no way that a legislator could have walked away from that, still saying that there's no such thing as chronic Lyme.
Okay. What's your name?
My name is Thea Doro.
Okay, and where are you from, Thea?
I'm from Danville.
Okay.
New Hampshire.
And what brings you to this conference today?
Well, I come to as many events as I can to learn as much as I can about Lyme disease and co-infections. I was diagnosed as well as my 2 children, so
Okay.
I'm very passionate, especially for my kids. So it's
Okay.
hard enough having Lyme, but it's really difficult to watch your kids go through what they go through when they have Lyme disease.
Have you been successful in getting treatment?
Yes and no. I mean, it's something that once you're chronic, I've been sick for many, many years, but didn't know it until the symptoms really flared in 2010. So I don't think you're ever cured. You're never really cured.
So what they're finding now is that it can be passed through the
Utero.
placental in utero.
Right.
I'm Jim Blake from Campton, and we're here because our son.
Campton, New Hampshire?
Campton, yeah.
Okay, that's where I'm from.
Yeah? Oh, really?
You'll see yourself on PVTV.
Oh, great. And we believe he has chronic Lyme disease. We've had him tested with the Western blot through IGNX twice, and it's come back indeterminate both times.
Okay.
So we just have to go by symptoms and
Yep.
what we've seen him go through. And he actually went to school with Dr. Young's daughter,
Okay.
who had Lyme. And they were on the track team together. And I still think they got it, they possibly may have gotten it at an away meet down in southern New Hampshire or something like that, just a guess, because I think there's another girl that was in their class who's living down south who has it also.
How old is your son?
He's 30 now.
30, okay.
Yeah. And we brought him with the first symptoms of pain in the knees back when he was still in high school, and we were told it's just growing pains and things like that, and it just came on really slow over probably 8 years, where you couldn't really tell what it was. It came on real slow, the symptoms, and then the last few years it just got to the point where it got overwhelming for him. And that's when we got him tested, and I started really looking into the Lyme disease. And he did do between 8 and 9 months of antibiotics, which we couldn't really tell if they were working or not at that point, but it started bothering his stomach quite a bit.
Yeah.
So he had to stop that, and now he's going to start the herbal treatment with, what's he going to take, Kathy? Andrographis and cat's claw and those type of things. He's working with an herbalist up in Sugar Hill.
Okay, so Jeff, I'm sure a lot of the people who are watching this are going to want to know what are the symptoms of Lyme disease and how is it diagnosed?
Okay, well, if you get bit by a tick and you get a rash called erythema migrans, then you're really lucky because it's like 100% sensitive. You know you have it and you can get treated right away. However, many people don't know they got bit by a tick, and then many people, when they get bit by a tick, don't get a rash even though they might get Lyme disease. Only about 1/3 of the people who get Lyme disease have had a rash.
Okay. Okay.
So
that's
very often,
yeah.
this illness lays somewhat dormant in the body. Sometimes people will get a flu-like illness a week or 2 or 3 after they get their tick bite, but it's like a flu-like illness.
Okay, so it's very, very easily mistaken for the flu, headaches, and then body aches, chills, fever. There can be a high fever. And then what happens if, okay, so how can we say this? What happens if somebody doesn't go to the doctor and they don't get diagnosed with Lyme because they think it's the flu? What happens?
That's a really good question. So it's different in a lot of people. Some people go from that stage and they just start getting sick.
Okay.
And they can get joint pain and headaches and continued issues with trying to be able to think, and can have vertigo and fatigue and just not get better.
Okay.
Some people recover and they say, oh, that was just a viral infection. And weeks, months, and even years later, this Lyme disease syndrome may activate or reactivate and come up with symptoms that aren't always, you're not always sure are symptoms that describe a disease. So we might be getting in our 40s and 50s and say, oh, I'm having trouble remembering things. Oh, it's because I'm getting old.
Okay.
Or wake up and, oh, my hip hurts today. And next week, oh, my ankle hurts today.
Okay, so that's a migrating arthritic pains.
Arthritic or arthralgic pain. And I'll just
Okay.
make a quick distinction
Yes.
for the medical people is arthritis really talks about joint inflammation and swelling, and arthralgia talks about joint pain. So you can have migratory arthritis or migratory arthralgia.
Okay, so a typical scenario for a Lyme disease patient could be that they go years before they're diagnosed, which is been made obvious by our first clip, where we show somebody who actually went 14 years before she was diagnosed, and she actually had heart symptoms, which
Correct.
I know from you that Lyme disease can actually affect the heart.
Yes.
And there are 3 pages of symptoms that you can possibly have with Lyme disease that are also with other diseases.
Right, and I do want to caution the public that our body can only respond to illness and stress and inflammation in certain ways. So a lot of the symptoms that are listed for Lyme disease do overlap with other illnesses, as you said. And so it's not, these symptoms mean Lyme disease, but they can indicate that things are going that way.
Okay, and so therefore Lyme disease becomes a clinical diagnosis as well as some kind of testing that's involved, which we're going to also talk about. We're going to show you a clip from Bob Jaguar, who talks about different Lyme disease tests that you can get and why some are better than others.
Ask me a question, or am I just going to talk?
Well, you can introduce yourself.
Hi, I'm Bob Jaguar, the Director of Sales at IDSA Laboratories. We're a specialized tick-borne pathogen testing lab, and we do a lot of work in Lyme disease. And I'm going to just mention some of the questions or the reasons that there's so much controversy in the lab testing. The screening test for Lyme disease, the titers, the test that you get up front from a physician, according to virtually every study I've seen and their published data throughout the years, has accurate in the neighborhood of 50 to 60% of the time. So you're going to get the right answer with your titer test half the times. So the ELISA test is something I would strongly advise not a physician to use as the end-all decider of Lyme. The physician's clinical impression, a doctor who deals with Lyme a lot, is far more important. It's a clinical diagnosis of Lyme. And then you should go, really, I believe, directly to a Western blot, especially in endemic areas or people who appear to have longer stages of Lyme or more confusing diagnoses. A Western blot will at least spread the antibodies across a blot so that we can see which antigens they're binding with. Now, the problem often arrives because of the lack of a full array of antigens in that blot. Many kit manufacturers and the ones that are approved by the FDA, for the most part, only look for antigens that show up in early Lyme. Now that eliminates bands 31 and 34 from being in any of these blots. And that is a real problem for a person who may have had Lyme for more than 3 or 4 or 6 months. The body's immune system fights this bug. The bug changes its outer surface and produces bands 31 and 34 significantly in patients who've had Lyme for a longer period of time. And because of that, you really need a blot that looks at all those bands. The 15 bands have been published on in the United States in peer-review articles for the last 20 years. You really do need a test that's going to check for virtually all of those, and most importantly, including bands 31 and 34.
Okay, so for the layman out there who really don't know what this means, what you're saying is that the typical Lyme test that you're going to get in the conventional setting from someone is probably going to be inaccurate.
Yeah, it's going to be right 50% of the time,
right,
45%.
That's not enough, and it's only going to show an active infection.
Absolutely.
Okay, so that's what I needed to know on that. And the other point I wanted you to, I know that you talked about in there, was the prevalence of Lyme in New Hampshire.
Oh yes, the Department of Public Health keeps putting up data of Lyme disease. You know, the group at the University of New Hampshire have done a nice job looking at ticks over the years and the presence of ticks populations that are infected with Borrelia burgdorferi. We now know that in New Hampshire, well over 60% of the ticks in all counties are CDC positive for Borrelia burgdorferi, which means that you have an endemic situation for Lyme disease according to CDC criteria in every county in your state.
Okay, so and that we rank third in the United States?
Third in the United States as of 2012 in the number of cases of Lyme disease.
Wow.
So you're getting worse, not better, and the deer population continues to be proficient here and kept alive. It seems that the hunters aren't getting a good job of...
My husband calls them the tick taxis.
Well, an average deer will carry about 300 to 400 ticks at any one time.
My God.
And you can assume that 50 to 60% of those ticks are carrying Lyme disease.
Okay.
So when they drop off and they go to find a nice little mouse, or they get close to your house, or they get in your yard, because remember, a deer comes back to your house if it's there once, and then in 2 weeks it's going to come back. They travel in about a 5 to 6 mile radius, and when they come back, usually between 2 and 5 in the morning to eat your flowers, they're going to bring some friends. And you'll usually see 4 or 5 deer in the early morning hours before sun, munching away on those wonderful vegetables in your garden or on your foliage that you work so hard to grow.
Okay.
And when they're there, they're going to drop off some ticks.
Okay.
And those are the ticks that are probably going to cause problems in your yard if you're not taking care of it.
Okay. And, you know, what do you think about guinea hens getting rid of ticks?
If you don't like your neighbors, guinea hens are the most proficient killers of ticks in the... They will... 6 guinea hens will eliminate ticks in half an acre. The studies have been shown.
Oh,
my
God, I love it.
The trouble is, your neighbors aren't going to like you because, as you know, guinea hens make a lot of noise. So, if you don't like your neighbors, don't worry about putting down chemicals on your lawn. Buy yourself some guinea hens.
You know, I thought my girlfriend and I thought about doing a business called Chicks Against Ticks.
They couldn't work.
we would just bring chickens to people's yard, but I don't think that would work too well. But we thought it was pretty fun.
It takes it takes 3 or 4 weeks, I guess, for them to clear out half an acre or so. But they will clear it out of ticks.
Okay.
Okay.
All right.
But the better thing is really try to get rid of the mice. The mice in your yard are the biggest issue. We're seeing more and more data that is starting to show that the ticks aren't going to live close to your home or in your yard close to it for long unless they have another host, and they usually find mice. So a mouse will carry anywhere between 5 and 30 or 40 ticks at any one time, and they'll keep them alive and take them back to their little nest where the ticks will get to proliferate.
Okay.
So there are things you can do to reduce the mouse population in your yard, and those are things you should really start considering looking at.
Thank you so much for your information. That is awesome.
Thank you.
Okay, all right, so what are your names?
I'm Holly.
Okay, Holly, and
Darlene.
Darlene, and what brings you here today to the Lyme Conference?
Do you want to go first?
Oh, sure. I'm here mostly for my daughter who has Lyme and Bartonella, and she doesn't sleep well at night, and she's trying to get through college. So we've been treated by some clinicians, but we're still struggling with her, and I want to learn more and learn about new doctors and their new technologies that, like your husband is learning from ILADS. So I'm here to educate myself, meet new doctors, and help her. And actually, my whole family has Lyme, so we're you know, I really have an great interest in learning more. So.
Okay. And what have you done so far that's been useful?
Well, we've done some antibiotics, some herbs, some changing of diet, but for me, I'm arthritis-related Lyme, so I manage it by using cat's claw, some herbs and things like that, after I've done antibiotics. And I still have the arthritis, but it's actually better than it used to be, so I'm managing it, if you will, but I'm focused on getting my daughter better right now first.
And, okay, and you also have Lyme.
I have Lyme, Babesia, and Bartonella.
Where do you think you were infected?
We have no idea. To my knowledge,
yeah,
I've never been bit.
we have no idea either. We've never seen a rash or a tick on us.
Yep, we've kind of traced it back maybe 17 years.
Okay.
To a certain a boyfriend I was dating at the time was an avid hunter. And he would come home with ticks on him and I would take him off. And if it wasn't then, it could have been from childhood because my dad was in the service. So when he got leave, it was like 3 or 4 weeks long. So we'd go Yellowstone, you know, and tent camping. So it could.
Okay, we've discussed some testing options, and now we're going to discuss some treatment options. Now, treatment options are actually unbelievably diverse. So what you're going to be hearing is probably more what my husband would do or what I help him do. But there are treatment options including antibiotics and herbal protocols and nutrition. So we're just going to try to touch on that to give you an idea of what can happen if you end up with Lyme disease. Okay.
A few editorial comments first. Okay. First, my practice is not completely Lyme disease. I see a whole lot of other conditions.
Absolutely.
Okay. And Lyme disease
is one of them.
And I know a fair amount about it. Second, if somebody gets bit by a tick and goes to their primary care doctor and you're not sure if the tick has Lyme disease, most likely, because of IDSA guidelines and an article that came out in a journal about 10 years ago, they'll get 1 dose of doxycycline, a double dose of doxycycline, as a prophylaxis and think that they're all better. Okay. Many doctors think that's curative early on in the disease.
So I just want to mention one thing before you head on, that when it comes to Lyme disease, if you want to go beyond the Infectious Disease Society Association, if you want to go beyond that, you need to find a doctor that's literate in Lyme through ILADS. Would that be correct?
And ILADS is not the only organization, but yes, ILADS is certainly
That's a way to start, right? So if somebody is an infectious disease control believer, then, and you think you have something beyond that, you might want to explore some of these other options.
I agree. Yes. So I will stick my neck out here and think that, and say that I think that 1 dose is a travesty.
Okay.
And that in many cases it does not prevent Lyme disease, just hides it a little bit from coming.
And we've seen that.
Yes.
I've seen that. Okay.
Me too. So, again, the standard treatment, if your doctor thinks you have Lyme disease or got bit by a tick that's positive in Lyme and you have symptoms, might be 2 weeks of doxycycline, maybe 3 weeks. It could be amoxicillin. Mm-hmm. However, the guidelines that I follow, I at least treat initially a new case for a month.
Okay.
And sometimes not just with 1 antibiotic, sometimes with 2.
Okay.
If somebody has symptoms, I may treat for longer than a month. And usually treat for about a month after the symptoms are gone. And this is a new illness. This is not what we were talking about long term.
Not long term.
I got a tick bite, I don't feel good.
Okay, that's actually really good to know, because that can help people, you know, understand that if you get a tick bite, it can be serious. Go take care of it. You can even save the tick and have it tested for Lyme. So it's actually really important.
And if you save the tick, put it in a baggie with a little moist cotton. Keep it. IGeneX will do tick analysis. Some state labs will do it.
Okay.
Also.
So now we're going to get into, somebody goes beyond the normal guidelines of the infectious disease, and they end up with what we think is chronic Lyme disease, or you think is chronic Lyme disease. Some of these treatment options.
Right. And by the nature of my practice, in that people can't get in right away, most of the people with Lyme disease that I see have had it for quite some time. And they're seeking not necessarily advice on Lyme disease, but on their general well-being, and we diagnose Lyme disease.
Okay.
So this is actually a very different illness. And the problem with Lyme disease, it could be Lyme disease with a whole host of other things. Babesia, Bartonella, Ehrlichia, things we call co-infections.
Okay.
And Lyme disease booby traps the immune system. so that other infections can live long and prosper.
Okay, so to just move on from that, because this can take a long time to explain. We work to make the immune system begin working again. Right. So it dampens down the immune system.
Right, dampens the immune system.
So instead of putting somebody on antibiotics right away for long periods of time, what can happen before that?
Okay, so, and I'll say this, I used to put people on antibiotics right away, and I found that, I think I found a better way.
Okay.
And the first thing I do, and with my patients and some of my colleagues' patients, is we intervene in their nutrition. And the reason is, nutrition is one of the ways we can enhance our immune system. Not only enhance it, sometimes the things we eat imbalance our immune system and make our immune system...
Why?
Well,
Where's the immune system?
We have 70% of our body's lymphatic tissue in our gut. And our gut consists of the intestines, the stomach, the colon. And a lot of what we eat can talk to that lymphatic tissue, which is our immune system, and create an immune reaction.
So
even if your gut feels good, your body can be reacting to what you eat by arthritis, by headaches, by vertigo, by fatigue. And the idea is to take that out of the picture.
So what people don't often understand is that everything you put in your mouth touches your immune system. Now, we've been dealing with a deteriorating food supply due to genetic modification, due to chemical pesticides, due to food processing, killing. So what we're talking about is we're not just depriving people of food. We're actually trying to boost the immune system by taking out those foods that offend the immune system and add nutrients that can also benefit the immune system so that the body can then fight the Lyme disease the way it was designed. Am I right?
That's correct. Okay. And then to actually boost the body by adding nutrient-rich foods that come from the earth and come from things that eat things that come from the earth.
Yes.
And that's how we were designed.
Okay, so that is a very important thing. And Jeff has found an association between changing the diet first and perhaps symptom reduction and reduction of the use of antibiotics. Am I right?
Right, and we get anywhere from about a 20% to a 50% symptom reduction when we really clean up the diet.
Okay.
Clean it well.
Yeah, and we're pushing this point because so many people are resistant to it and don't understand the importance of that. But I'm going to move on from that now because that's a huge focus for us. But there are other ways once that occurs and along with that herbal protocols can be used.
Right. So when I first started treating Lyme, which was over 10 years ago, probably closer to 15, I wasn't impressed with the herbal protocols that were out. But since that time, there have been some very good improvements in packaged products, actually, that are available to doctors, and some are available to patients. And I have found that I can use the herbal products very often after using diet intervention to lower the disease burden in a person, so that in the long run I may be able to use much less antibiotics and use them less long.
Right.
In my experience, however, it's been a rare occasion where I have gotten by without using antibiotics at all to treat Lyme disease.
Okay, and that's important. And the other thing we want to stress is that these herbal protocols are not covered by insurance. The only thing that's really covered by insurance are these antibiotics. And some people don't even have that coverage, or they only have it for so long. So I think it's really important to take into consideration the whole person that you're treating, right? And making all these decisions has to be a very unique a process for each person.
That's correct. Everybody's biology is different.
Okay.
Just that, as was exemplified by one of the earlier persons you interviewed on this, or somebody that's to come,
yeah,
that her husband had Lyme and was sick for many years. And she didn't feel sick, but she probably had Lyme for the same amount of time.
Oh, she had Lyme longer. Okay.
And so our bodies react differently.
Okay.
And I could give an example, if we have time, non-Lyme related, but one of my teachers in functional medicine talked about a woman who got really sick, and she was evaluated by her doctor. She was nearly on her deathbed, and it turns out that she had arsenic toxicity. Mm-hmm. And then they suspected her husband, who was very well, of poisoning her. And then in the process of his incarceration, he got tested, and his arsenic level in his blood was higher than hers.
Okay.
But he wasn't showing the signs of the illness, so he could tolerate it better. What it turned out is their shop in their yard, mm-hmm. where he did woodworking, he used a lot of the old arsenic-treated, pressure-treated wood mm-hmm. to make stuff,
okay.
and contaminated both of them.
So the lesson being that we are unique individual biological entities that when given a substance or we're exposed to something like Lyme disease can have completely different outcomes.
Right, and sometimes the practitioner has to look into the person's genetics, the person's biochemistry, and many other aspects of how that person processes everyday stuff.
Okay. Okay, so you're getting some different, it's hard to give specific treatment options. Actually, you can't really do that because it's so unique and individual. So the things that we're trying to impart on you is that if you're feeling chronically ill with Lyme disease, then you want to find, hopefully, an ILADS trained doctor in order to get longer term treatment. And nutrition is a very important part of that. But not all doctors do that at all.
That's true.
And osteopathic treatment is actually very important as well. So my husband uses osteopathic treatment, which is a hands-on treatment in itself, and he gets a lot of information from putting his hands on a person's physical body, so that he can find out kind of where they're at, and it helps in the treatment of Lyme.
Right.
So there are so many different aspects to this mind-body medicine, and this the herbal protocols, the antibiotics, the nutrition. There are just so many different avenues. Right. So.
And there's 15 or more now ILADS trained doctors in our state, and hopefully we can get more now that we have that legislation in.
Okay.
And there's more and more people becoming open-minded about it.
Yes.
And seeing illness.
Now, if they wanted to find an ILADS doctor in New Hampshire, what would be the website that they would go to?
I would start with ilads.org.
There you go, ilads.org.
And sometimes Lyme Disease Association.org can help as well.
And I will probably put on the credits a couple of other things that you can look up for more information on Lyme disease. So thank you for watching, and there might be a couple of other clips you're interested in here that are going to show the different phases of Lyme disease. Thank you.
And thank you, Heather, for having me on the show.
Thank you.
What's your name?
Oh, it's Becky Powell.
And what is your story with Lyme disease?
My daughter got sick when she was 12.
Okay.
And we went for a year from doctor to doctor to doctor to doctor. And finally, a year later, we had to self-refer to a doctor. And her PCP didn't believe that it was Lyme disease, no matter what I had my research had shown. So we finally got the IGeneX testing and had to do a urine test, and it came back positive for the DNA of the spirochete.
Okay.
And then we started treatment, and it's been 4.5 years that she's been in treatment.
Wow.
And she had 2 years ago, she had a possibly a reinfection.
Okay.
So
she started having much more different symptoms, much more severe, more neurological, more, she was in a wheelchair for a while, she had the tremors and shakes, she talked with an accent because it affected her throat and her speech, so it sounded like an accent. So we went on IV antibiotics after that, and we're still on IV antibiotics. So we did 16 months on a PICC line, and then we had a break, tried to see where we were, and then now we're on she has a port put in, and IV antibiotics along with some oral antibiotics. So, you know, she's better than she was then. She was walking, and we hadn't had the severe episodes are almost a year old, but then last Monday night she did have an episode in the evening, which was a surprise, but brought on by stress and fatigue.
Okay.
But other than that, she's walking around, she's doing schoolwork at home when she can.
And so it's the antibiotics have been life-saving.
Yep, for getting her better past that point.
Okay.
She's just not well yet. She's just not. Every time we try to take a break from them, she just gets worse.
Okay.
So, and we've taken breaks because we wanted to know what's causing side effects of medication versus symptoms. So we take breaks and try to feel out, are you just having a side effect? And so
got it.
We know it's still symptoms, not just side effects. So we've tried all different combinations of medicines and some herbs, and we're still fighting it.
Well, thank you for your story. And you've got some nice information up here for Lyme disease education.
Yep.
Yeah.
Awareness and education.
Yep, and that is one nasty picture of a tick. Whew. Now, how big is that, really? And like if it was on your finger?
That one, like pinhead.
Oh, that's scary.
Yeah.
Okay. Well, thank you so much.
You're welcome.
Zoom in on this. What is this?
This is a collection of ticks that came from a private homeowner's yard in Hollis, New Hampshire. And what you see is just a variety of life stages of both black-legged deer ticks and dog ticks.
Oh, that is gross. Woo!
We're here. I'm Ted Sainamon from Atlantic Pest Solutions, and we're here to give out information on ticks to demonstrate personal protection, yardscaping, and even solutions for applications if we need to go that route.
Okay.
So we've got information posters. We do free seminars, education programs for schools, your business, anybody that's willing to listen to us.
Okay, let me see that thing again. That is from one person's yard. That is gross. Wow. Whew. Thank you.
Thank you so much.
And you're called?
Atlantic Pest Solutions.
Thank you so much. And what's your name?
Nicole Chappelle.
Nicole. And what brings you here?
My Lyme disease, but they thought it would be a good idea that I come and learn a little more because there's so much to learn in regards to co-infections, symptoms, treatments, Lyme.
Neurological Lyme, yes.
And it's the best place to meet people.
And you can meet people that are going through the same thing, and it's a comfort.
What kind of, do you have neurological Lyme?
I am special.
And what are your symptoms?
Same as everyone else's, with the pain, brain fog, inability to function some days, getting lost going home.
Okay, so it's gone into your brain.
Yes, it has.
Okay.
It has.
And have you found any treatments to be helpful?
There are no treatment that crosses the blood-brain barrier.
Okay.
I cannot do antibiotics or herbals.
Okay.
Because I have a genetic predisposition that does not allow me to filter toxins.
Okay.
And because I can't filter the toxins, if you give me that medication or that herbal, and I have the die-off, which is the healing crisis or the Herx reaction, I get very, very sick.
Okay.
And I can't function. So that's not something that's an option for me.
Ah. So do they ever try to help you with the excretion of the toxins?
I do detoxes, Epsom salt baths, Himalayan salt baths, Berber. There are many detoxes that you can do.
Yep.
Green tea, EES. We do EES. That's a 2-hour treatment once a week, and you sit in a room and you get electromagnetic fields. And there's no side effects. The only thing that happens is you either feel better or you don't feel anything. That's what's working for me currently.
Okay.
With both the pain and energy.
So you said what was the treatment with the electromagnetic?
It's EES.
Energy enhancement system.
Energy enhancement system.
Okay. Energy enhancement system. I'd never heard of that.